Hello everyone. The next developmental disturbances affecting oral and paraoral structure, that is the developmental disturbances affecting the number of teeth. There are total 3 developmental disturbances that affecting the number of teeth. Those are anodontia, hypodontia and hyperdontia. In this video, I will discuss about anodontia and hypodontia. First is anodontia. Anodontia, that means there is total lack of tooth development. It may be of two types, total anodontia or partial anodontia. In total anodontia, all teeth are missing. It may involve both deciduous and permanent dentition, and this is a very rare condition, but when it occurs, it is frequently associated with a more generalized disturbance, that is hereditary ectodermal dysplasia. Next is induced or false anodontia. It occurs as a result of extraction of all teeth. The term pseudoanodontia is sometimes applied to multiple unerupted teeth. Then true partial anodontia, it is also known as hypodontia or oligodontia. It involves one or more teeth and is a rather common condition. Although any tooth may be congenitally missing, there is a tendency for certain teeth to be missing more frequently than others. For example, frequency of missing third molars to be congenitally absent. Maxillary lateral incisor and maxillary or mandibular second premolars are commonly missing and often bilaterally. In severe partial anodontia, congenitally missing deciduous teeth are uncommon, but when it occurs, usually involves a maxillary lateral incisor. Then etiology. Etiology of a single missing tooth is unknown, so it may be idiopathic. According to Graeber, result of one or more point mutations in a closely linked polygenic system. It mostly transmitted in an autosomal dominant pattern with incomplete penetrance. Occasionally, because of X-ray radiation, tooth burrs are extremely sensitive to X-ray radiation and may be destroyed completely by a relatively low degree of radiation. Then hypodontia. Many cases of primary hypodontia appear to be autosomal dominant pattern with incomplete penetrance and variable expressivity. But other cases exhibit support for an autosomal recessive or sex-linked pattern. Several investigators have reported variable expressions of hypodontia in monozygotic twins, which is confirmed by DNA fingerprinting. This disorder confirms the occasional multifactorial nature of the process. Overall, hypodontia most likely represent a variety of disorders which is caused by various genetic and epigenetic factors. There are less information is available on the genetics of hypodontia, but many cases they suggest an autosomal dominant pattern with incomplete penetrance. Then clinical features of hypodontia. Developmental absent teeth are one of the most common developmental abnormalities with a prevalence of 3.5 to 8%, excluding the third molars, and female to male ratio is around 1.5:1, and in the clinical picture you see there is missing of maxillary lateral and mandibular incisors, and in the radiographically you see there is no underlying teeth and there was no history of trauma or any extraction. And in case of anodontia, which is very rare, and most cases occur in the presence of hereditary hypohydrotic ectodermal dysplasia, and hypodontia is also uncommon in the deciduous dentition with the prevalence around 0.5 to 0.9, and when it is present it mostly involves the lateral incisors. Hypodontia is associated positively with microdontia, reduced alveolar development, increased freeway space, and retained primary teeth. When there is a mutation of PAX9 gene, it creates an autosomal dominant pattern of oligodontia that can involve various teeth, but most commonly it affects permanent molars. In severe cases, there is loss of primary molars, second premolars, and permanent mandibular center incisors also may be seen. Mutation of the MSX1 gene is also inherited as an autosomal dominant trait. Those affected with this mutation tend to demonstrate loss of the distal tooth of each type. In these patients, the most common missing teeth are the second premolars and third molars. In severe cases, often the maxillary first premolars and maxillary lateral incisors are also missing. With this MSX1 gene mutation, the degree of oligodontia is so severe with an average of approximately 12 missing teeth per patient. Next, mutation of AXIN2 gene. The pattern of oligodontia is inherited as an autosomal dominant disorder, with the most common missing teeth are permanent second and third molars, second premolars, lower incisors, and maxillary lateral incisors. Presence of the AXIN2 mutation has been associated with development of adenomatous polyps of the colon and colorectal carcinoma. Next is sequelae with hypodontia. That means what are the further complications associated with hypodontia? First is abnormal spacing of teeth, delayed tooth formation, delayed deciduous tooth exfoliation or shedding of deciduous tooth, late permanent tooth eruption, altered dimension of the associated gnathic regions. Then treatment for hypodontia. The treatment of the patient with hypodontia depends on the severity of the case. There is no treatment may be required for a single missing tooth. Prosthetic replacement often needed when multiple teeth are absent. Therapeutic options include RPD, removable partial denture, traditional fixed prosthodontics, resin bonded bridge, or osseointegrated implants with associated prosthetic crowns. Use of fixed prosthodontics typically is not recommended for children because of the risk of pulp exposure during abutment preparation, and because further growth can lead to infraocclusion and ankylosis of teeth held together by the prosthesis. In some cases of hypodontia, orthodontic therapy may improve the restorative treatment. Patient with oligodontia, increased prevalence of orthodontics associated with external root resorption. This may be due to the altered root anatomy or to the extensive tooth movement that is required in some patients. Sometimes follow-up radiographs are recommended after 6 to 9 months of therapy to evaluate the root morphology for evidence of excessive resorption. Early diagnosis and treatment often are crucial in minimizing the aesthetic and functional problems of the adjacent teeth. A consequence of late therapy, it may include the delayed eruption, resorption of the adjacent teeth, displacement of the teeth with associated crowding. So these are all about anodontia and hypodontia. I hope you like this video. Thank you so much.